Welcome to this video series on resources to use for self-directed learning. This video will introduce the ClinicalKey database. ClinicalKey is a point-of-care resource you'll find in most clinical settings. It's designed for physicians and provides quick access to evidence-based, peer-reviewed clinical information. It's been described as Google for doctors because it includes so much information from medical textbooks, journals, drug monographs, multimedia, and more. You can access ClinicalKey from the Medical Library website, through the app, or directly at clinicalkey.com. The first time you use ClinicalKey, you should access it through the Medical Library website. There's a link under the Databases tab. You should register for a personal account so that you have full access to all features, including saving content, downloading PDFs of book chapters and images, and accessing saved content on the app through your iPad. You should also activate remote access. This will allow you to bypass the library and access directly from clinicalkey.com with your personal account. You will need to log into ClinicalKey through the library website every 180 days to maintain remote access. In ClinicalKey, you can search or you can browse by source type. When searching, it's best to keep it simple. So I'm going to do a very simple search for hypertension. You're likely to get a lot of results because there's so much content in the database. First, it says there's 2 books on hypertension, so you could take a look at those. The next thing I see are clinical overviews. So you'll see a lot of these in the database. And there's also one pulled out over here to the right. Some of these overviews come from the textbook collection. Others will say Elsevier point of care. These are synopses written by experts for Elsevier that include evidence-based information, guidelines, and the latest advances in clinical practice. So it's like a point of care tool. If you keep scrolling down, you'll see several other clinical overviews, and then maybe some other source types. So here's a journal article from the journal Obesity Pillars. Here's another journal article, a guideline from the European Journal of Internal Medicine, and you may see some book chapters as well. So the filters on the left will help you narrow down all of these results. You can narrow by source type, and you can see all of the ones that are available. I'm going to go ahead and narrow to books. And then you can also narrow by specialties. And there are a lot of specialties to choose from. Just scroll through and then you can see how many result in each specialty as well. I'm going to choose physiology. And so now I have chapter excerpts from the textbook collection. So this is a chapter from the Guyton and Hall textbook. And I could click on that to read that section, and I can save that if I want or email it to myself. If I go back to the top of the book chapter, you'll notice there's a PDF, but it's grayed out. Some of the books will allow you to download chapters as PDF files and some will not. So if it's grayed out, then you don't have that option, but you can still save the chapter to your personal favorites. So if I click the star, I've already saved this chapter, but then you can apply a tag, save it in a certain area. I applied this with my hypertension tag, or you can create a new one. When you want to go to your saved content, you click the hamburger icon in the top right and go to saved content. It'll all be there. If I scroll down a little bit, I want to show you one more thing. Here's a figure, and these can be saved as well. You can also add these to a presentation. So if you click this, you select a presentation. I'll again select one that I've already created called hypertension. And then I'm going to add and view that presentation. Go to hypertension. So here are all the images I've saved to that presentation. And then I can export those, and it will download those images to a PowerPoint file. and you'll see the image and also the copyright information already attached, which is kind of nice. So those are some of the highlights about ClinicalKey. I would encourage you to explore this database, browse some of the different source types, because as a physician, this is a resource that you'll be using for many years to come. For information on some of our other resources, see our self-directed learning LibGuide, and be sure to reach out with any questions that you have.